deaths caused by drug abuse.
The drugs are not illegal, they're not illicit. Instead, they are from your local pharmacy. Dr. Joe tonight with why some feel, though, they could be a prescription for abuse. Joe?
Well, Denise and Kathy, we're talking about common painkillers like oxycodone and fentanyl. Deaths from these drugs have tripled between 1998 and 2005, a trend some here in Florida hope to change. Every drop of the IV is a small step toward recovery. Brent Brown got this treatment after collapsing at home.
My parents found me on the bathroom floor one day, and, they knew something was very wrong.
The treatment wasn't for an infection or heart problem. Brent was addicted to drugs. No pusher and nothing off the street. Brent's meds were prescribed by doctors.
Couldn't sleep was the main problem.
Restless leg syndrome caused unbearable tingling in his legs. Xanax helped him get rest.
Of course, my tolerance goes way up, and then I need more and more.
A trip to a different doctor for a different problem resulted in Brent taking 4 times the Xanax and even more meds.
Well, I made the mention of, I can't sleep still. And the words came out of his mouth, well, I'll get you to sleep. And he did, with about 4 different drugs.
It's just legal heroin.
Steve Hayes owns a facility where Brent got treated. He says nationwide abuse and deaths from prescription painkillers like oxycodone, oxycontin, and methadone are on the rise.
A lot of our patients that come in here talk about how easy it is to go out and get these drugs.
Some patients doctor shop, and some doctors give out pain meds too freely. Still, Hayes thinks there's a solution.
Florida state government is trying to put a registration system in where a doctor who sees a patient will actually be able to pull up the patient's record and see if they have been prescribed any other narcotics.
But the idea has been met with opposition. Some state lawmakers fear it would limit privacy rights. Others think it would keep meds from patients who need them most. Hayes believes it will prevent many from getting hooked and help patients like Brent get the treatment they need.
It's an amazing feeling. I'm very proud. So when I walked out the door, I was clean of everything, and I haven't had a pill since.
Now, Brent's been out of treatment for a year. He's back to work in real estate, and he's already run a half marathon. He's also helping others kick their addictions. As for the registry, I spoke with Senator Mike Fasano's office today. They say Senate Bill 462, or a compromise bill, should be up for a vote this May. If it passes, it takes effect in July 2009. Kathy?